Today, I'm very excited because we have a very special guest on the show today. And without further ado, let's introduce Dr. Muhilan.
Hi, Jin. Can you hear me?
Hi, yes, we can hear you loud and clear. Dr. Muhilan, how are you?
I'm good. I'm good. Just for a quick check, are you
Yeah.
having any problems with stalling or any internet slowdown the speed on your side?
All right, so no worries. When you are looking at the screen, there might be a bit of a lag, but rest assured, when it
Okay.
actually get broadcasted,
All right.
it's usually quite smooth. So the way we work around
Excellent.
it is that we pace the speed of our conversation. So before we start, I just want to say hi to some of our early guests, Noor Kase, Noor Adina, who's joining
Mm-hmm.
us. Right.
Okay.
So just to warm things up a little bit, Dr. Mulian, and the question I regularly ask is, no, I was saying, we are more than a year into this COVID pandemic. What did
Yeah.
you miss most about life prior to all of this situation?
I guess hanging out with the boys. Now I can't hang out with anyone, so I'm stuck at home. And I miss the holidays. Hey, Malaysia's
Yeah,
got a lot of very nice beaches, right? So I miss them. But yeah,
yeah,
basically hanging out with people. The social bit is annoying. Not being
yeah.
able to, face-to-face meetings, meet your friends, stuff like that. How
And
about
you
you?
get cooped up in an environment, right?
Yeah, you do. And by the way, are you leading up to infertility on this one? Or are you going to say that we're supposed to have more babies? No, because there was this theory that, we're supposed to have more babies after the MCO, which
Yeah.
actually strangely didn't work out. I think the birth rate actually dropped with people stuck at home.
Maybe there's a bit of performance anxiety.
Probably, or suddenly you get to see, like staying cooped up with your husband may not be such a great thing. You may want him out of the
Yeah,
house a bit more.
right.
Right, right. So what was your first question again, Yasnan? Did you ask me something?
No, no, no. All right. So I'm just going to
Okay,
address the public here, and I'm just going to let them know how we're going to do it. So,
right, cool.
guys, kawan-kawan semua, this is just going to be a no holds bar session, right? Because
That
it's
that's scary.
organized by Doctor on Call, and we are the coolest medical platform in the country and Southeast Asia. I'm not tied to
Okay.
any particular hospital. So, we can say whatever we want.
Okay.
And do feel free to ask your questions here, right?
All right.
Post them. And, we know that when you ask a question, it's always for your friend and someone else. It's never about you, right?
Yes.
Yeah. So, a bit
Yeah,
of
I do it too.
introduction. Yeah. Dr.
Okay.
Muhilan is a urologist. I'm not sure what the term is in Bahasa. Is it Doktor Pakar Kelamin Lelaki or
Oh
Dokter
God, no.
Pakar Sakit Tuan?
No, God, that sounds
Yeah,
horrible.
that doesn't
It's
matter.
just,
You guys know.
actually, when I introduce myself, I say Paka Buah Pinggang. It sounds a bit better than all the rest. Paka Urology. Actually, government uses Paka Urology, lah, right?
Yeah,
But,
Pakar Urology, right?
urology. So, just in
Yeah,
short, what do? I deal with everything related to the kidney, the bladder, stones, infection, infertility, both usually for men. I don't treat female infertility. And men's sexual
yeah,
health, your STDs, your infection, the whole lot. Anything to do in male health, men's health, anything to do with your kidney, and anything to do with your bladder and prostate, right?
yeah,
So, and I both do surgeries, give medication, both, right? So we are cross. We are not like the physicians who do pure medicine or surgeons who do pure surgery. We do a cross of
yeah,
both. So mix and
yeah.
match, depends what works.
So,
Okay.
Dr. Muhilan, you are
Mm,
also a bit like a performance coach, right? So I imagine,
yeah.
when you go to a wedding dinner and someone asks you, what do? You tell them with a straight face, I help men rise to the occasion. Whew.
Whoa, I haven't used that one. I haven't used that one, right?
Right?
So usually, right, if someone asks me that question, like, hey, usually a question like, hey, bro, malam semalam tak boleh buat apa-apa, how? Said, that's the usual one, okay? So the thing is, right, don't have to freak out. You don't have to run off and kill some poor tiger and take his penis, right?
Yeah,
There's a lot we can do for you. But the main thing is to tell you what it is, whether it's in your brain or in your penis, right?
Fantastic. Right.
So it'll work from there. But everything is fixable with just time and effort. That's about what's required.
So before we jump right into it, I'm very it's lunchtime now, and we have so many of our audience on board. So you know what, guys? I'm seeing. Thank you for joining us, Damina, Arif, Ash, Rabiatul. So I tell you what, like and share and tag 3 of your friends, and my team will buy you lunch or tea, courtesy of Dr. Jin. Right?
What
2
about
persons
me?
lah. Huh?
What about me?
Your team will buy you lunch, courtesy of Arif. Right?
Okay.
So, kawan-kawan, tag 3 kawan, like, share. Lepas tu, team saya akan PM kamu, tanya kamu nak makan apa. KFC ke, McDonald ke. Alright, let's see those shares coming in. Feel free to ask your questions and we will jump right in. Now, so Dr. Muhilan, just start off right. Apakah punca kesuburan, ketidaksuburan di kalangan lelaki di Malaysia? Right. What appears to be one of the main reasons for infertility in Malaysia?
Right. So if you have infertility, that means your sperm, something wrong with the sperm lah. So the worst case scenario, sperm kosong, tak ada sperm langsung.
Yep.
The second one is
shooting
blanks. The second one is the sperm cacat. So either tak laju, tak gerak, bentuk tak betul, atau nombor tak cukup. Okay, so divide into 2 lah. So let's start the common one. The common one is actually sperm tak sihat.
Yeah.
Alright. So sperm tak sihat is number 1 in Malaysia is lifestyle. Okay, we just eat too much, right? So obesity. So when you gemuk sangat, we convert the male hormone to female hormone. Sperm tak sihat. That's number 1. 2 is temperature. You know, you pakai tight underwear, simpan laptop atas, on your lap. Actually, the name says laptop, but you're not supposed to keep it on your lap. So temperature. Okay, it's just too hot. And one of the things that you tablet control is kadang-kala you got like varicose veins. So varicose veins is like, you see those dilated veins on your legs. You see it sometimes in people walking around, the big swollen veins, blue color, all over your hands and legs. If you get them on your scrotum, on your balls, they cause the temperature to go up. So when temperature goes up, sperm not healthy. Wow. So commonest in Malaysia is hormone tak betul, which is normally due to food and your weight. And the varicose veins. These are 2 commonest. Okay. Sperm kosong is either you're born unlucky, your genetics tak menghasilkan sperm, or you pernah dapat jangkitan or something yang menyebabkan tube tertutup. So you hasilkan sperm, tapi sperm tak boleh keluar.
Okay, fantastic. So, ladies and gentlemen, we have just given you a preview of what we will be talking for this whole session for the next 1 hour. So, Dr. Muhilan will be going into a bit more detail on each of them. But I see someone, Lukesh, asked about bicycle. I think there are tons of people who's wondering the truth about bicycles. So we address those later. But before that, I think there's this burning question that, ladies are always thinking about. In the past, when I used to watch movies or ancient time, whenever a family does not have children, it's always the lady's fault. It's always the lady's fault. Blame the wife. So tell us the truth, Dr. Muhilan, in your opinion, what is the percentage like, when a family is unable to have children, how often it's a problem with the lady side and how often is it a problem in the man's side?
Okay. I would love to say it's 100% female side, okay, but I can't, right? So it's an equal split, 50-50, right? So 45% it's something to do with your wife, 45% it's something to do only with your husband, and there are 10% of people who are truly unlucky. Both husband and wife have problems, right? So take it as equal split, right? So it could be your husband half the time and it's probably your wife half the time.
And maybe, another 10%, the 110% are some people who may not know how to have sex properly.
Yes. Okay. So that one, so amazingly, there are still a lot of people who have problems in their sex life. So they're healthy, all good, no babies. So one of the things that people come and see us about, very common, and it is very, very common. They have a poor sex life or they're not having sex and they want a baby. So they shortcut to the IVF process or IUI process and have a baby. But the problem is not fertility, the problem is sex. And by the way, just to tell you, we can fix that as well. It takes time, it takes counseling, but yeah, we can improve your sex life. It's more fun, right? It's definitely more fun.
So, Dr. Muhilan, do you do that?
Yeah, I do sexual health as well. I actually
Fantastic.
do more of it now. But sexual health, classically, you see really young guys, young couples, 20s, 30s, and for whatever reason, they just have problems. So for the ladies, it's often peer pressure. They're so nervous, they're so scared, they get pain or discomfort. For guys, it's usually like, okay, first day you are stressed and it doesn't work. Second day you're stressed, so it doesn't work for sure. By third day, you're expecting to fail, so pretty much it's not going to work, right? So it's more you failed once and you expect to fail. You see, guys, right? The reason sex works for us is we know we are going to succeed.
Yeah.
So we don't think about it. It's automatic. It works.
Yeah.
We think about it too much. You start focusing on it. You're going to fail.
Yeah.
So we help. We have medication. We have ways to get you around the barrier. Takes time, but yeah, I've done it enough times to get you past the barrier.
Yeah. So for our audience, Dr. Muhilan is available for teleconsultation, right? And his schedule is very packed, So drop us a message, come to our site, and we will organize a session for you to meet him, right? And I think there's no shame in learning and really improving the quality of life, right? There's no other organ in the human body, maybe short of the brain, that is responsible in bringing so much happiness and pleasure in life.
Yes. Okay, that's a very guy thing, but yeah, definitely. I mean, it's not only that. Okay, so I'll give you a quick scenario since we're on this topic, right? Moving away from infertility. All right, so guy fails one time. Nothing to do with the wife. It's just that, okay, all his friends have put so much pressure on him on how he should perform like some porn stuff for the next 5 hours. So it's like he's all stressed up, he fails. Next day he fails. Third day he fails. You know what happens next? The wife gets pissed because the wife thinks husband does not find her attractive. She thinks there's something wrong with her, so husband can't perform. Wow. So she feels down. And you know what happens when she feels down? She gets angry.
Yeah.
Then she takes it out on you.
Yeah.
And lagi you tak ada mood.
Yeah. Okay. So it's a vicious cycle.
Yeah, it goes around and around. And guys are interesting. There's this very interesting fact about us. The reason we don't have sex with everybody, or we don't try to have sex with everyone, is our brain divides women in our life into people we have sex with, or we want to have sex with, and people we are not supposed to have sex with. So your family members, your colleagues and all, you look at them, you're not that interested, right?
Yep.
Family members and all, they're family. And then you have your girlfriends or your wives, and they're your sexual partners.
Yeah.
Now, when you don't have sex with your wife for, say, an extended period of time, or you've never had sex with her, your wife moves from sexual partner to family. So your brain registers your wife as family member. And no matter what, you're not going to get turned on. Okay, because she's in the wrong category. She's in the wife family category. So wives are unique. They are family and sexual partner. So when you lose that, no sex. Because you're just not in the mood to have sex.
Wow.
And so an interesting fact for you to play with.
That's very insightful, Dr. Muhilan.
Yeah, but haven't you seen it? If you have long time no sex with your partner, you're no longer interested, no matter how hot, how good looking, how whatever, you're just not interested because your brain thinks they belong in the family category.
Wow.
Women that you don't touch.
Wow.
That's
very
nice.
Insightful. Yeah. Okay.
Okay.
So, let's console some people a bit, right? Like, what do you think is the rate of infertility in Malaysia? I think everybody wants to get the feeling that they are not the only one.
Oh, no.
Is it really common?
Yes. Okay. So very interesting. Since World War II, when plastic use really increased and hormone tablets really increased for female contraception. Male infertility rates have doubled every 20 years. So
Wow.
in your father's time, say before 1940, right? Before 1940, where we started keeping records, infertility was like 1% of population, right? It's basically now somewhere around, I would say a conservative estimate, 1 in 5 guys has a problem with his sperm. That's
Wow.
20%. That's 15, 20%. That's a lot. Okay. But most of it is undiagnosed. We don't find it because people just don't come forward. People don't come for treatment after 10 years of marriage, normal sex life, no babies. So
Yeah.
male infertility has been skyrocketing. Now, the problem is
Wow.
this it's the plastic in the water, it's the plastic in the containers, it's the fertilizers and pesticides in your food. In Western countries, believe it or not, it's the oral contraceptives flushed down into your water system. So they have huge amounts of estrogen in the water system.
Wow.
Uh, and all its plastics and stuff like soya and all that, they're called phytoestrogens. What they do is
Mm.
they stimulate estrogen activity in you. Not great for guys, right? It's not great.
Yeah.
So male infertility doubles every 10 years.
Wow.
So that's in the last 60 years. So we are looking at 20%. Trust me, you're not alone. Okay. And very soon you'll probably be in a majority of guys who have fertility problems.
So
Okay, that sucks.
better start buying water filters now.
Hey, yeah, actually, when I bought a water filter for my house, I tried looking for something that removes chemicals from the water.
Yeah.
And except for some reverse osmosis stuff, nothing else seems to work.
Nothing else seems
Yeah.
to work, right?
But look, your plastic containers, you heat it up, they release chemicals that affect your hormones.
That's true.
Your fast food chicken, where your chicken used to take old kampong chicken takes 6 months to grow, right? The new
Yeah.
chicken comes to your table in 40 days. They get it there by using
Yeah.
hormone shots. Pork contains hormones. Shitload of stuff contains hormones that make them grow bigger and faster, and it's bad for us.
So it
It's
makes
bad for your fertility.
it makes the food you eat grow bigger and faster, but it makes your balls shrink smaller and faster as well.
Right. So, okay.
Indirectly.
Yeah. So, I'm going to give you a simple example because this one's very common. It's pork. I know a lot of people don't eat pork. This is
Yep.
just an example. So, if you take a pig and you
Yep.
give it beta blockers, it stimulates estrogen production in the pig. So the pig eats. I mean, literally it eats. But not only that, it stores water. So when you weigh this pig and you're about to sell it to the butcher, it weighs a lot, right? It's a
Yep.
big fat pig, which means you make more money as a farmer, right?
Mhm.
Fantastic. Problem is that beta blocker and that high estrogen levels are in the food that you are consuming, and estrogen is not good for us. Okay, it gives us male pattern balding. It causes breast enlargement. It causes us to gain weight around the tummy, and your
Yep.
sperm counts just go shoo. That's it. You're screwed. And this
Yep.
happens very gradually, day by day, right? Your
Yep.
soya products, not great for guys. The organophosphorus that they use for pesticides, not great for us. All this stuff
Mm.
causes high estrogen.
Yep.
So I'm not sure what you can eat or drink. Okay, I honestly don't know. Okay, uh, because organic is expensive. It is very expensive.
Yeah.
Fish seems to be safest, but a lot of fish now contains mercury. So I guess try to eat as healthy as you can, but understand that some of this stuff is going to enter your body.
Correct. And
All right.
as time goes by, I think there will be more and more need for people to come out and seek help, medical help,
Yeah.
right?
So
Because the natural means are just a bit more difficult already.
no, you see, all right. So you're trying to be natural here, right? You're trying to be healthy.
Mm.
Don't smoke, don't drink. Work out 5 hours a day, get your 8 hours sleep. That's you, right? You're trying to do
Yeah.
all this good stuff. But the forces that are opposing you, let's call it the dark side for all those who watch Star Wars, all right? The dark side, right? Is just so many things. The dark side is getting stronger and stronger. It's all the
Yeah.
chemicals in your food, the chemicals in your drink. And all that sugar and carb that we eat, and I'm guilty of this as well, it gives us a tummy for guys.
Yeah.
And tummy fat converts male hormones to female hormones.
Yeah.
So if you try doing naturally, it's just that you're doing this much and the bad stuff is that much.
So much working
So
against you.
yeah, so you need help. All right. There's no shame in this. We need help. the natural stuff by itself probably, it's not going to work that well. It works at the early stages, but in the long term, you will need help. But we
All right.
we help you, then you get back the natural stuff.
Yeah. So Dr. Muhilan,
Mm.
let's look at a scenario. So a couple who just got married, maybe
Mm.
married for a year and a half or 2 years,
Yeah.
and they are not having kids. And they're
Right.
beginning to think that something may be wrong. Walk us through the thought process, the proper
Right.
thought process that, and I think for the benefit of everyone here, and I'm sure a lot of people are in this category, right? So
Yeah.
walk us through what should we think about? What should we start doing?
All right. So the first question is, right, am I having enough sex at the correct time? All right. I have couples who come and tell me I'm married 2 years, but my husband spends 20 days in Penang and I'm here in KL. Not going to work, right? So roughly, if you have sex on average 2-3 times a week, you're in the correct ballpark, right? 2-3 times a week. If you're trying for baby,
Yep.
mid-cycle, that means a woman's day 12 after her periods. That week, if you have sex 2-3 times a week, and you've been doing that for 2 years, you probably have a problem, right? So first step, I say start with the easiest things to do. Don't run off, don't do operations, don't do scans, don't do any of that stuff. Do a sperm count because it's easy. It's non-invasive. You ejaculate, take the container, give it to a lab, call you guys, right? And send it to doctor on call. You get a semen analysis done, and it'll tell you whether your numbers are good. Now, when you're doing a semen analysis, please don't have sex for 3 days, right? 3 days. If your counts are bad, don't panic. Repeat it again.
Yep.
So this is a simple test. It costs you like $100 odd. Non-invasive, easy to do. If you have 2 tests that are abnormal, it's probably your husband. Something with us guys. Okay? Okay.
Yep.
If your sperm counts are perfectly normal, ask your wife to see a gynae. You can see us at TMC Fertility. Dr. Navdeep and Dr. Chong are available.
Definitely TMC Fertility.
Yes.
Yeah.
Okay. The guys will kill me if I suggest any other place.
Yeah.
But to be fair, I've known them for 10 years. They are a pretty good combo, right?
Yeah.
So the first thing they do is they're going to check your health status. Do you have any hormone deficiencies for your wife? They're going to do your thyroid. They're going to do your female hormones. Simple blood test, again, not very expensive. And they're going to do something called an AMH. AMH is a measure of how many eggs are in your body, right? So women are born with all your eggs. You don't produce anymore. That's it. You're born with 10, you're born with 10, you're born with a million, you have a million. So at that moment in time, do you have enough eggs?
Yep.
Now, I told you there's environment factors affects guys, it affects women as well. So there's some women, young women, no eggs, right? Or the egg levels are low.
Yep.
So the first thing they do is they check your eggs. They check, make sure you actually have good eggs, no medical problems, right? At which point we sit down with you and tell you, look, the problem is your husband or your wife. If you reach this stage, then we assume there's some problem. Your wife is not ovulating well, or the eggs are not sticking to the wall and she's not getting pregnant, right?
Yep.
So we'll run through your options. The first step always is let's fix anything wrong we find. If your hormone levels are wrong, we fix those. If you're overweight, we try to reduce your weight a bit. If your periods are irregular, we adjust that. Simple things. And I tell you to go back and have lots of sex. Lots and lots and lots of sex. That helps.
So from
If it
2 to
doesn't-
3 times a week to 2 to 3 times a day.
Hey, look, okay, it's worse. It's a lot of fun. Even if it doesn't work, it's a lot of fun, right? Okay.
Definitely.
Okay,
So,
but let's say we fix
go
all
on.
the issues, right? We fix all the issues, and you're a young, healthy couple, and this is for couples, let's say 30 plus and below, early 30s and below, right?
Yep.
And your sperm counts are normal. You could try. We give the wife or the guys, we give them Clomid tablets. So instead of producing 1 egg a month, they produce multiple eggs. So your sperm have more targets, right?
Yeah, more targets.
More targets. We tried that for 3 or 4 months. If it doesn't work, we go to the next one. It's called IUI, where basically, you see, your sperm is really, 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 really tiny. And that little guy has a long journey. It's got to swim through the vagina, swim through the uterus, swim through this long tube. It's like you walking from Johor to Penang, right?
Wow.
It's a long journey. So IUI is basically we give you Air Asia
Booster.
flight. Oh, sorry, we give you a flight. I won't promote Air Asia here. We give you a flight from Johor to Penang Airport, and you get to just walk from Penang Airport to your house, right?
Wow.
So IUI is we use your own sperm. We don't take out anything, no operations, and we just give the sperm a shorter journey to the egg. It works. It works 30-40% of the time.
Yep.
That fails, you go to IVF. So
Fantastic.
that's your journey basically. But for guys, sorry, do you want to ask me something or shall I continue?
No. Continue. Go ahead.
You're good, right? So
Yep.
that's if the problem is the ladies. Now, if you guys have a problem, that means we do your sperm counts, right?
Yep.
And it comes back bad. Okay, let's do the worst one. Your counts come back zero, absolute zero. You check twice. Okay, so you come in, I'll do a checkup for you. And it's a blood test and a simple examination. So I will then tell you broadly you belong to one of two categories. One is you're producing sperm, but they can't come off from your body. The treatment is, we use a needle or we do a surgery to take out the sperm. That's it. And you go for IVF.
Yep.
If your sperm counts are zero, but the problem is production, that means those factories that produce sperm are just not working. They're bad shape.
Yep.
We decide whether I can fix the factories or not. If I can fix the factories, well and good. We give you hormone medication, we give you medications, you start producing sperm, and we see numbers are good, try normally, numbers not great, we do IVF. Okay, so we first decide whether it's a problem with production or a problem with the block, and then we fix it. And we have pretty good numbers, right?
Fantastic.
So we have pretty good numbers. So yeah, it works. So that's your simplified version of your journey. Did that answer your question?
So I'm just gonna fantastic, very well. So just to recap it for the audience who just joined us, basically, when you have kids, when you're married, or you're trying to have a baby,
Right.
and it's not happening yet,
Right.
So what Dr. Muhilan is saying is increase the effort. I think that's the best way to put it. Increase the effort, try more. If it still doesn't work, do a sperm test. Dr. On Call will soon, very, very soon, be offering you the ability to just book the sperm test on our platform and just get it done very fast. And we will advise you, right? Dr. On Call, we have our panel of GP doctors, sometimes I myself. We will help you through the first few steps. And then we will guide you accordingly if more needs to be done to see either Dr. Navdeep, Dr. Chong, or Dr. Muhilan, who will solve your respective problems like that. Okay, so moving along, I just want to say hi to some of our audience, Rabiatul, who has shared a lot, and also hi, Maran, my boss, right? So
Okay.
now that we have addressed that, let's go into a bit of trivia. And I think, as more and more people come in towards the later part, we can revisit some of these topics again. Because I'm
Right.
sure a lot of people are wondering about this thing about mobile phone.
Okay. So
back pocket, front pocket, chest pocket.
all right. Okay, so I actually had this phobia myself, so I actually bought this things to block radiation. You put it next to your bed, it blocks radiation from your phone, it blocks the RF signal, it does all kinds of shit, right?
Yeah.
And then I finally decided to use my brain and actually go do some research on this, right? Instead of listening to some garbage that somebody says. So the RF radiation that's coming off, unless you are literally sitting on top of a transmission tower, that means you decide to climb a tower, sit on it the whole day for the next few months, you're not going to fry your testicles. All right, short version, you're not.
Okay, that's good to know.
And the simple thing, if you're very worried about it, look, you go online, all models of phone, they now release the RF signature of the phone. How much radiation and frequency is by your individual phones. So whether it's an iPhone, whether it's an Android phone, whether it's Samsung, whatever, there's a list, right? If I say that list, it's going to sound, how you say, Okay, the higher end phones do seem to have less radiation release.
It's a
But
very politically way to
yeah,
put
yeah,
it.
right. But the thing is, for the amount of time that you have in your pocket, it's not much. It's not going to affect the testicles much. Okay, they're pretty resilient. You're not going to affect it. All right.
Yep.
It's probably more dangerous sleeping with a phone under your head than keeping it next to your testicles.
Yep.
So I wouldn't worry too much about the phone. On the long list of headaches that you have, forget the phone, right? It's the least one you want to worry about.
So we have a gentleman earlier who asked, where is your clinic, Dr. Muhilan? So let me just
Oh,
address that. So Dr. Muhilan can be found can be found. It's not the
okay.
right term, but you can book an appointment with Dr. Muhilan through Doctor on Call. His clinic will be in TMC Fertility. There's a few locations, right, Dr. Muhilan? But
Right.
Damansara
So
is where you are at most of the time.
yeah, I'm mostly in Kota Damansara. So TMC Fertility here is with our sister hospital, Thompson. So
Yep,
I'm here. I run my clinic here. But you're right. You can contact me through Doctor on Call, or you can Google me and call my number. Right.
fantastic. Right. So
Okay.
moving along next. So first people think about phone.
All
Then
right.
next thing on everybody's mind is this skinny jeans, right?
Okay.
Tight
Hey,
skinny jeans.
that one might actually be true. Now, if you're a woman wearing tight skinny jeans, hey, good for you. I love the view. All right. If you're a
Actually,
guy, okay. Uh, hey, I'm not forcing anyone to wear skinny jeans, right? If you're a guy, look, your testes hang outside the body is to radiate heat. Okay. The reason your testes are outside the body is to release heat to the environment. So wearing
yeah,
a tight underwear, wearing tight jeans, you're not helping the testes release heat. You're keeping it all trapped there. Temperature goes up, sperm counts drop, right?
yeah.
Production drops, and how they grow drops. So tight jeans look great. Okay. Not on me. I look terrible in tight jeans, right? But I'm sure some guys look good in it. But they're not great for your testicles. Personally, if you don't care, I would say skip the underwear and wear nice loose shorts and loose clothing. But if you want to wear underwear, wear those loose boxers kind. This is again going to sound damn racist, but I got no other name for it. Those old Apex shorts, the square white ones that people used to wear, the loose boxers.
Yep.
Yeah, those work wonderfully. Go with loose clothes, will maintain your testicles in good shape.
Or the
Tight
good old
clothing,
sarong. Or the good old sarong lah.
the good old sarong and go commando. Don't wear anything.
Yeah, right.
That'll
And
maintain
now we know how is it that our grandparents have like 5, 6, 7 kids.
yes, they weren't wearing tight jeans
Yeah,
and they weren't
fashion
walking
statement.
funny. Yeah, fashion statement is killing us, man. Fashion statement is killing us.
Yeah. So I
Okay.
think being in the sarong also helps you get into the action faster, lah, right?
Well, it's certainly a lot less things to remove to get there. Okay. All right.
Right. This is getting
Okay.
fun. Now,
Mm.
next, let's just shoot straight away. Smoking and alcohol. Which
Right.
of the two
So,
levels? Yep.
I have a lot of fertility patients who smoke, right?
Yep.
Smoking is a long-term killer. That means it probably did affect your sperm over the long term, last 5, 10, 15 years. To see the effects of stopping smoking is going to take time, 3 to 5 years.
Yep.
So if you are already coming for fertility treatments and we are trying to get you pregnant the next 3 to 6 months, you are going to have a very stressful, you'll probably be worried about this whole process. I usually don't tell you to stop smoking. It's not going to make a big difference. I know it goes against conventional wisdom. Smoking is bad for health, right? It's bad for your lungs,
Yep.
it's bad for your heart, it's bad for everything. But in terms of affecting fertility in the short term, not much.
Okay,
In fact,
that's good insight.
the evidence is very weak, right? Temperature has the biggest evidence, right?
Wow.
So your tight skinny jeans and your tight underwear and keeping your laptop on your lap is probably the worst, right? Stopping smoking in the long term is good for you. You should stop. But sadly, in the short term, it's not going to do much for your sperm counts.
Yeah.
Alcohol, right? If you drink a bottle of Black Label every day for 5 years, you kill your liver, and that kills a lot of stuff.
Every.
All
Yep.
right. You're having 1, 2 beers a day. For God's sake, go enjoy your 1, 2 beers. Don't worry about it. It's not going to do much to your sperm counts. Right. So everything in moderation, a beer a day, a beer a week, occasionally hang out with friends, have a couple of beers, not going to do much to your sperm counts. If you're on the older side, be warned that if you drink, you're probably not going to perform all that great. Okay. But that's not fertility, that's performance, right?
Yeah.
But my patients already have, my people who come to me already are stressed about the infertility issue, right?
Yeah.
And I try not to add unnecessary stress by removing things like smoking or drinking from their life. If it's harmless, it's not bothering them. If it's not changing my treatment, I don't tell them to change. I focus on getting them a baby and reducing
Yeah.
their stress. Stress makes it difficult to get pregnant, right?
Yeah.
So
For
I know
many
it's not
reasons.
so I know it's not conventional medicine. I know I don't sound like a good doctor. I'm telling you to keep smoking and drinking, but my job is to help you get a baby and solve your problem,
Yeah.
right? So that's what I'm doing.
And I think the audience really appreciate this kind of honesty, right? Because we are practical people, right? We have
Yeah.
life, we have work, we have issues, we have COVID to deal with, right?
Yeah.
And sometimes we just need to do whatever that's practical. But a bit of advertisement for a while. At Doctor On Call, we do have a smoking cessation program. Drop us a
Oops.
PM and we'll, no, I mean, we do want to help people who wants to quit smoking.
No,
And I
no,
think
I
Dr.
do.
Muhilan will definitely support every effort to quit smoking as well.
Yes.
Yeah,
I
so
definitely would.
we have a program and appropriate medication to help you quit smoking. Okay, let's move along then, right? Because we were talking about hormonal issue, right? And then now
Right.
we get a little bit into the medical part where we're talking about diabetes, sugar, right? Too much
Right.
sugar, diabetes, and a bit about hyperthyroidism as well, right? And I'm
Okay.
sure we have gotten quite a bit of requests, feedback. We have patients who have hyperthyroid, hypothyroid, diabetes, and how does this whole messy environment work with male fertility then?
Okay, let's do them one by one.
Okay, sure.
Strangely, the hypothyroid is the one that I target the most. Okay, if you are hypothyroid,
Hypo
your
means low, low.
low,
Correct?
right?
All right.
Your sperm production is almost zero.
Wow.
Okay, they suck. And it's the easiest one to fix. That's why we check it. We always check it. So if you haven't had it checked and you are being treated for infertility, get it checked. Because it's easy to do. You correct the thyroid function, everything goes back to normal. Your sex life is back to normal, your sperm counts are normal, everything goes back normal. And the same applies to women. If your thyroid functions are bad, you are not ovulating properly. But women will not ovulate properly. Am I back? Yeah, sorry.
You're back. Yeah, there
I
was
had a bit
of
of
a
interruption there.
no worries.
So that's for thyroid. For diabetes, right? High sugars will cause urine infections, fungal infections that will mess up the tubes, so you may get blocked. They can damage the nerves in the long term, if more than 5 years, so you have problem ejaculating. You may damage the blood vessels, so you can't get an erection. But does it directly cause low sperm counts? No, right?
Okay.
What was the third hormone you asked me for? You said diabetes.
Yeah, diabetes, thyroid. So I think we've covered both. But when we're
Right.
talking about diabetes, then you eventually lead over to cardiovascular disease and obesity. And
Right.
how does it
Okay.
correlate then?
Okay, so this one's really important. Those things, okay, if you are obese, let me deal one by one.
All right.
Chances are you are converting male hormone to female hormone. Your sperm counts will drop. Your sex drive will drop. Okay, so that's what obesity does. Now, there's a very interesting statistic that says if you have erectile dysfunction, not low sperm counts, erectile dysfunction, within the next 3 years, you have a 1 in 3 chance of getting a heart attack.
Wow.
So why that is your blood vessel that supplies your penis is roughly the same size as the blood vessel supplying your heart.
Yep.
So if that one's not working, there's a pretty good chance the one in your heart is not working that well either.
Wow.
So about just during Raya, just before Raya, I had a young 37-year-old fit guy. I mean, he's fit. He looks like you, right? He came to see me with a 3-year history of erectile dysfunction. He was a diabetic for 2 years, pretty good control. I was feeling a bit paranoid that particular day. I'm glad I was paranoid that day. So checked him. I asked a colleague of mine, cardiologist, to just do a stress test. He failed the stress test
Wow.
within 5 minutes. So they did an angio. Every blood vessel, there are 4 big ones in the heart, they were all blocked. And 3 of them were above 90%, and 1 was totally blocked.
Yep.
So his Raya was in the hospital where he had 4 stents done. Because he was roughly speaking, he was 2 months away from a heart attack. And when you looked at his heart, it showed that he had a heart attack, a silent heart attack, about 3-4 months earlier. He didn't know it, but you could see his part of his wall was dead. And if he had not come for erectile dysfunction treatment, if he hadn't come for sexual treatment, he would have had his first and last had a heart attack this year. Which sucks if you're 37.
Yeah.
Right?
Wow, that's tough, man.
So that's cardiovascular.
We have a lot of patients, right, who are coming us for Viagra. And I just want to address the crowd. Like, if you are topping up the Viagras, like nobody's business, we're gonna really encourage you and make you go do a cardiovascular checkup. And Dr. On-Call, we are actually now trying to negotiate and come up with a program to do your stress test at a much affordable price. I think TMC is going to help us do it at a very affordable price as well.
Okay.
Right?
I just boosted the cardiologist.
Yeah, man. And it's really true, all things are interrelated. Now we have about 10 minutes left, Dr. Muhilan, and I'm sure there's really so much we can cover. I think maybe we can do a Saturday night live show and things like that going forward. But
that'll be fun.
Yeah, that's so. Let's look at some of the other issues, right? The naughty things that people do, right?
Okay.
The STDs and the masturbation. There are a few people have asking, how does that relate to fertility?
Hey, if masturbation makes you happy, masturbate all you want. Makes zero difference to your fertility, and will probably contribute to you having a more active sex life, right? Masturbation, forget what the internet says, harmless, right? Your sperm live for 3 days, then they die. So keeping them for long periods of time, not doing you any favors. Masturbation, no harm, short version, male or female. If it makes you happy, go for it. No pantang, right? STDs, right? That's a big one. Okay. If you have multiple sexual partners or you've had multiple sexual partners, your risk of STD is there. Using a condom only during penetrative sex does not prevent all STDs. STDs can be transmitted by oral sex, and almost every guy I know doesn't use a condom during oral sex. Jin, how about you?
I cannot comment.
Why? Do you use a condom during oral sex? Yes or no?
Yes.
You do? Really?
Yeah.
Okay. I think you're a liar, but anyway. All right. So the STDs, gonorrhea and chlamydia, they can be transmitted by oral sex and vaginal sex. So if you're going to use a condom, be like Jin, who claims he uses condom all the time, which I totally don't believe. But anyway, we'll give him the benefit of the doubt. That's number one. Number two, certain viruses, but they're harmless, HPV or HSV, herpes simplex, herpes HPV, human papilloma virus, they transmit skin to skin. So unless you have a whole body condom, you can pick it up just by skin to skin, just by hugging people, you can get it, right? But they're harmless, they have no long-term life consequences, so forget them. So the big ones are gonorrhea, chlamydia, HIV. HIV, you can't transmit by oral. Theoretically possible, but very rare. Gonorrhea and chlamydia definitely can, right? And when they enter your body, a large amount of them don't cause symptoms. So you don't feel it. You don't have discharge. You don't have burning urine. But they can affect your internal organs. In women, they can block the pipes. In males, they can block the pipes and they can cause infertility. If they are symptomatic, get it treated, right? Because it sucks to have greenish fluid coming out of your penis. I mean, it's horrible. Who wants greenish fluid coming out of your penis? Simple antibiotics. Within 3 days, you're fine, right?
Yep.
It's very easy to treat. And follow Jane and use a condom for oral and vaginal. Okay, but
As often as you can.
but the politically correct answer, which I don't think you're going to listen, is don't have sex with anyone
Multiple.
at random. Have sex with only your partner.
You're right.
Try being good boys. Try something new. Okay.
and you will
Alright.
save your future self a lot of problems, right?
Yeah, you might. Okay,
Yeah.
on the assumption your partner is a good person as well.
Wow, tough life, right? But we're
Okay.
city dwellers, right? And that's the reality of life.
Yeah.
Now, on to those jamu, home remedies, traditional Chinese medicine, acupuncture, tongkat ali.
Right. Let me
What's the
start
deal?
acupuncture. Okay, acupuncture for women, right? There's actually some pretty good evidence that it seems to help women who are undergoing IVF treatments to get pregnant.
Wow.
I don't know why, I don't know how it works, but there were 1 or 2 papers I came across.
So TMC does acupuncture. TMC Fertility does acupuncture, I believe.
Yeah, I think they do.
Yeah.
Yes, you're right.
Yep.
We have outsourced center, a separate center that does alternative medicines.
Fantastic.
You're right, they do. Okay. Now, Jamu, Ayurvedic, Chinese traditional, all the rest. I think as long as you stick to proper herbs, not little capsules that contain steroids, but real herbal treatments. Worst case scenario, it does no harm. Best case scenario, will it help you? I honestly have no clue. Okay. I've tried Tongkat Ali. Hey, for the heck of it, everyone always tries it. It made no difference to me. Okay. It made no difference. Maybe I got the bad quality one. I don't know. But a lot of people like it. I can't see the harm in it. Right. So if it makes you happy, go for it. So alternative medicines, as long as they are traditional, they are massage, they use the proper herbs, they're safe. The danger is if they add in chemicals and stuff. I don't see anything bad about it. So, like I said, at its worst, it does no harm and doesn't do anything. At its best, it may help you. So, if you believe in it and you want to try it, yeah, go for it. I have no objection.
Fantastic. Now, how about oysters, seafood? There are some words going around that,
I've tried that one also. I don't know. I once sat and had like a dozen of the buggers, and I hate oysters, right? I hate oysters. I tried 12 of them. And again, honestly, I'd rather go take a tablet. I probably had better effect than the 12 oysters did for me. And honestly, a tablet was cheaper than the 12 oysters, right? 12 fresh oysters are bloody expensive and they don't taste all that great, at least to me.
Yeah.
So I prefer the tablet.
Right.
But I don't think it makes a difference. Leave the oysters alone. Let them live free in the sea.
Yeah. Well, time is running out fast, right? So let me just do a bit of pre-closing, right? So Dr. Muhilan has spent, the last 1 hour with us, sharing with us all the insights, all the insider news about this whole area of fertility and the sex life. We definitely want him back again. We'll probably do something a little bit more interesting next month or so, right? We'll probably talk about specifically going into performance issue, erectile dysfunction, premature ejaculation, and STD and the likes of those. But maybe you can just summarize it for us, right? For the benefit of those who came in late and who missed the first part, right? So what are the main causes of infertility, and what we should really keep an eye on?
All right, for guys, look, if your sperm counts are 0, all right, if you are an infertile couple, keep it simple. Do your sperm counts first. Simple, easy test. If you're 0 sperm count, either it's a genetic problem, you're not producing sperm, or it's blocked. Either way, you need treatment. There's no medication. There's no alternative treatments that are going to fix it. If your sperm counts are low, again, it could be genetic, it could be hormonal, it could be obesity, it could just be a bad lifestyle. So treatment is fixing the underlying issues. That's about it, I think. Fairly simple in a nutshell. So simple thing, if you are having problems with fertility, do not blame your wife. I know it's very tempting. Don't blame your wife. Go do a sperm count first. It's easier than getting your wife to go for treatment, right? Go do a sperm count. Doctor on call as soon as they have it ready. You can do it from home. Just ejaculate into a container, send it out. a lot of what you believe affects your fertility actually doesn't. Smoking doesn't do much. Masturbation does zero. It's good for you, right? Go for it. If I wanted to give one piece of advice to my son to maintain his fertility, I'll tell him wear loose clothing, skip the skinny jeans, skip the tight underwear. All right, simple ones. Forget the phone. The phone is not going to do much for you either. Okay. All right.
Right.
Okay, Jin.
Thank you so
And
much.
Jin will discuss your ED problems on the next one.
Not my
Okay.
ED problems, the audience's ED's problems, right? And
Okay,
okay,
man.
so ladies and gentlemen, if you want to see me, myself, or even not me, myself, Dr. Muhilan back again for a much more spicier topic, things related to ED, PE, STD, and these days even sex toys. Wow.
You have a fun life, don't you?
You know, attachments, elongations, pumps, and stuff like that.
Okay.
Do comment, right? Just drop us a note. Tell us that we want to see you guys back again, and my team will make sure we do that. With the amount of stuff being sold on Shopee these days, I'm extremely curious how do they work or not work. So,
Hey, you got to buy a few.
Dr.
Buy a few and try it. Hey, thank you, guys.
Right.
Thanks,
so,
Jin.
Okay, maybe the next session we just bring one up and show and.
Hey, no, seriously. Hey, buy some. Let me know how it works, and hey, just buy some, and we'll discuss them.
All right. Thank you very much.
All right.
Have a good day, everyone. Please stay safe. Observe the SOP. We want to reduce the COVID counts and have a good day. All right. Thank you, ladies and gentlemen. Bye-bye.
Bye.